Welcome to Prespectives, the vodcast of the American Mental Health Counselors Association with the National President and Interim CEO/ED, Dr. Beverly Smith. This vodcast will bring to you the perspectives of clinical mental health counseling as it pertains to ethics, public policy and legislation, multiculturalism and social justice, as well as leadership and advocacy. This vodcast will feature experts in the clinical mental health counseling field to enhance the work of clinical professionals and to inform the public. The American Mental Health Counselors Association advocates for over 130,000 licensed clinical mental health counselors in the United States who are licensed to assess, diagnose, and treat mental disorders. We are the only organization working exclusively for clinical mental health counselors. Join the Prespectives for insight from experts on wellness and daily living, current clinical research, integrative healthcare, as well as how to maintain personal, family, and organizational wellness in an anxious and ever-changing world. Let's connect and hear the perspectives.
Hello and welcome to this podcast of Prespectives. I am Dr. Beverly Smith, President and Interim CEO/ED of the American Mental Health Counseling Association. Today, I have a colleague who I've worked closely with this year. He's just an awesome professional, an awesome colleague, and an awesome individual. Today, to Prespectives, we have Dr. Fred Dombroski with us. Fred, if you can, introduce yourself and just share with the audience a little bit about who you are.
Sure, that sounds good. And thank you so much for having me. And it has been such a pleasure to work with you this past year. You've done so much for the organization. I can spend a full 45 minutes just talking about how awesome you are. But I know I'll have an opportunity to tell you that, but we'll talk about that a little later on. But I've been working, I was very lucky to start working in the counseling field back in 1999 when I was working on my undergrad. And I went to graduate school in 2004, and I got my master's in clinical mental health counseling in 2006. I'm originally from Buffalo, New York. I'm licensed as a mental health counselor in New York State, and I'm a licensed professional counselor in Connecticut. I currently live in Connecticut. I'm also a licensed alcohol and drug counselor. I've worked in like various settings. So I've worked at several different hospitals, being the director for various types of programs. One of my favorite jobs I ever had was working at the Westchester Medical Center, where I was the director for the Gateway program, which specialized in LGBTQIA plus treatment with a heavy emphasis on transgender clinical mental health counseling. And from there, I became one of the main directors for the director of clinical operations, where I ran 5 inpatient units and 3 outpatient units. And that was definitely a lot of fun for sure. I appreciated that. We also had a treatment program specifically for individuals diagnosed with borderline personality disorder. And from there, I went to work for the Connecticut state system at Connecticut's only maximum security forensic hospital at Whiting Forensic Hospital, which was absolutely a lot of fun. I really did enjoy working with the clients there. And from there, I moved on to full-time academia, although I still do some training and consultation for the state of Connecticut, specifically about working with transgender clients and also providing a lot of education and training.
It sounds like you have a wealth of experiences, as you mentioned, in different settings. So AMHCA is very fortunate to have you, but you have done great things in the profession and you've been a leader. This year, you were the president-elect for AMHCA, and we are in the process of transitioning for you to become the president of AMHCA. And so as you begin to walk and transition in that role, all of your experiences, I think, and your leadership roles lends itself to you being the president of AMHCA. Would you agree with that?
Oh, yeah. Yes, absolutely, for sure. And I don't, it's weird because I kind of conceptualize my relationship with AMHCA to be symbiotic and reciprocal. So all the jobs I was able to get was really because of the awesome, wonderful work that AMHCA has done. So I've been a member of AMHCA since I was getting my master's degree back in 2006, doing a lot of my continuing education and training, and connecting with my local Western New York chapter helped me find jobs, connecting with the state chapters helped me find jobs, but also connecting with ongoing education and training through AMHCA's conferences and doing the additional, there's like webinars and also following up with the certification. So through our certification board, we have our diplomates, and I was approved for co-occurring disorders uh, credential, and then within that, that helped open up doors. And so I'm so blessed and lucky to have an opportunity to serve AMHCA, because truly, unconditionally, AMHCA has served me ever since I've been a member. So my goal is to be able to provide that opportunity for other people to be as served as much as I have been by AMHCA, and really try to support AMHCA because they've just been a wonderful support to me.
Mhm. Sounds like servanthood leadership is important to you, and you have modeled that. And so, thank you for having modeled that. And also, as you begin to transition to the role of president, to continue to model that, because I think servanthood leadership is important, and giving back and modeling that is important. You have several areas of expertise within the clinical counseling profession. Let's talk about that a little bit more. I know you mentioned it a few minutes ago when you talked about the areas that you've served in, but let's talk about your area of expertise in clinical mental health counseling.
Absolutely. Yeah. And I appreciate that, because the places I worked at, I never had the luxury of saying no. And so, like, if a client was referred to me and let's suppose they just got out of jail for murder or something like that, a lot of clinicians may have felt uncomfortable working with the client, but I never felt I had the luxury of ever saying no. And because I didn't have that luxury, I had to do ongoing continuing education and training to be prepared to work with that client. And that's how I got started specifically working with transgender clients. Was we
Mhm.
had some transgender clients who were referred to us, but nobody had any experience. And when we tried to find people with experience, we just really couldn't find people. So I had to pay for my own supervision. I had to do my own continuing education. And I'm so extremely thankful I did it, following up with the WPATH standards of care, because out of all the areas that I focus on, that has been like one of the most fun and fulfilling aspects of doing clinical mental health, and also trying to help any of the people in the behavior, um, the helping professions, to become more comfortable working with transgender clients, because there's a lot of fear about making a recommendation that someone may not like. But the truth is, when we're providing transgender care, the client guides themselves. We do gender exploration, we do advocacy, we do linkage and referral as needed. So it's not difficult. It's actually a whole lot of fun to do. And yet there's just a lack of information about how to work with trans clients. And for me, it's just been a lot of fun.
Oh, that's good. So when we talk about transgender clients and multicultural and social justice, what would you say would be the leading issue that we need to address as clinical mental health counselors?
Yeah, and I really appreciate that question, because there are so many different ways that we can be pulled into. So with I so I think that we absolutely have to continue to advocate for access to services for underserved populations, as well as ending a stigma. One of the ways I've tried to focus those, I've tried to focus on the experiences of marginalized counselors, or counselors of color, and their experiences working with clients from various backgrounds. And so specifically last year, I started providing trainings here in the state of Connecticut for free to various agencies, specifically about how white clinicians can support counselors of color or counselors from marginalized backgrounds, specifically as clients are clients. They are going to have their problems, and sometimes clients will act in ways that are racist or marginalizing or othering to clinicians. And although we expect clinicians to be able to have the skills to manage it, sometimes uh, privileged counselors, in our best attempts to help, will actually invalidate the counselor who then just got disrespected by the client. So that is something I've really kind of focused on, because in many treatment centers, we don't really necessarily have the luxury of kicking a client out. Yes, there are rather like step-by-step processes to remove a client if their behavior is continuing continuing to be hurtful. Within that said, though, a lot of the counselors can still receive a lot of negative statements and a lot of hurt from the client, especially when there's been generational pain that's attached to it. So that is an area that I've tried to focus on specifically, as to how we can listen and support individuals who are being marginalized even within the helping profession. And so that is just something that I found myself having a heart for, because we need more diversity in the area of counseling. And I appreciate that it's going there, but we're not fully representing the people that we're servicing. And therefore, I also want to support people in any way who are experiencing marginalization while they're being committed to help. So I just found my heart like naturally going towards there.
And that's good. It sounds like you've done stellar work. You've done free workshops. I hear your passion for the work that you do. As you're doing the work, when you encounter any opposition, if you will, and I know all the time we do not always see everything eye to eye, how do you deal with the opposition? Some may say, you know what, we don't need to do a lot of work in diversity, equity, inclusion. We don't necessarily really need more work in multiculturalism and social justice. What do you do? What do you say when you encounter those comments or perceived oppositions?
Yeah, that's a great question. For me, I know this might sound kind of awkward. I enjoy experiencing that opposition openly. So I actually feel better when someone says, hey, listen, I don't know how this is going to be helpful. I've done all this work on myself. We're moving in whatever direction. I respect that. One time I was doing a transgender training, and I was in a room with a group of clinicians, and I asked them, how do people feel about serving transgender clients? Everyone said it was okay. Everyone said they had no concerns. Everyone said, but one guy was like, listen, I don't feel comfortable. I don't know. I feel conflicted. I was like, thank you so much. Because all the other people who were saying that they were supportive of trans clients were saying verbiage and words which were actually not supportive and not validating for trans clients. Or at least this guy was like willing to be like, hey, listen, I'm struggling. And he was willing to accept the feedback. My conceptualization of, I don't consider it opposition. I kind of conceptualize it like from a motivational interviewing aspect. Part of my job is to identify some of the benefits of the buy-in of what we're trying to talk about. And also what I really appreciate about like AMHCA and counseling in general is we are a work in progress. Mm-hmm. We're getting better year by year. So if someone did a training last year, that doesn't mean that the training is the exact same or appropriately applicable to everything that we're doing now. So we are trying to modify and also like validate, a lot of these issues have become polarized, and people might have a natural reaction to some of these issues. And people are allowed to have their thoughts and feelings. Ultimately, though, within the helping professions, though, we're here to serve the client. Mm-hmm. And if we identify ways to get out of our own way, then I think that's always a benefit. And especially when we say, oh, no, I don't get in my own way at all. Nothing bothers me. It's great hearing that. I appreciate that. And we're like, all right, well, let's explore that then. Let's talk about that. As opposed to saying, telling someone, hey, you're wrong, this bothers you. So open opposition doesn't necessarily bother me, because I appreciate someone's willingness to tell me what they think. Mm-hmm. And I love rolling with resistance. Like those skills, like the rolling with resistance skills are like some of the best used skills, both with our clients and also with coworkers. And so those are some of the best.
Absolutely. And so when I use the word opposition, maybe I should have used the word resistance or ambivalence. So when we think about, motivation interviewing as a theoretical base, we do consider ambivalence as a better term, maybe than, resistance or the involuntary client or individual. And so that maybe is a term that, maybe I should have utilized ambivalence. And so it's good to hear your thoughts and your comments. You mentioned something about open resistance or open ambivalence, if you will. And so the difference between the open and the closed, because sometimes individuals are not necessarily open, they're closed, but may not know that they're closed to being supportive, lending a voice to those who are disenfranchised or marginalized.
Yeah, like it makes sense, especially we work in fields where people are hopefully working on this stuff pretty regularly. and therefore, when we say, hey, listen, we're gonna have an open discussion about this today, it would make sense that people might minimize the benefits of that discussion, and therefore they may not necessarily want to participate. Mm-hmm. what I really am so thankful for, and I really have to thank AMHCA for all their help specifically with me, is like through my years of experience. And I think also through your years of experience, we can probably pick out the certain individual case studies, which would really kind of hone in on the difficulties of whatever marginalized population. And then presenting that to the group, especially in a way which is validating and client-centered. And when we present something like that, usually some of the stories, like I think we can think about various clients who did not receive the best care for whatever reason. And then presenting this and how that's a problem, usually I could then see the people who would not want to participate at least have a response. And be like, all right, well, what do you think about that? Well, that's kind of messed up. Well, let's talk about how this could have happened. Let's go back and dissect step at a time. And I appreciate your willingness to adjust the language from opposition to resistance, and though just judgment-free zone. I've had people be like straight up oppositional, and that's fine. I mean, that's okay. What I appreciate about that is everyone though is usually able to buy in when I say these words. Hey, we're here to focus in on the client. Is it important for you to get out of your own way to help the client be able to do their work? Everyone's usually able to buy into that. And then through the hours, if we do like a 3 or 4 hour training, I usually get enough, not challenging, but enough instances where there are difficult discussions and people see me like use the OR skills and validate people's concerns, that then even people who don't want to participate will eventually participate and open up a little bit. And that's all we can do. I mean, this is like this, I'm a work in progress. I'll be the first one to admit there's like, I don't think I'm ever going to be able to stop working on myself. Like something new is going to irritate me every day. And I'm also very situational depending on what else is happening. So I need all the help I can get. So I don't ever expect anyone to have an immediate change, but as long as we can plant the seeds and move hopefully in the right direction.
Absolutely. And I agree with you. I think we're all a work in progress. Every day, there's a new opportunity to reflect, to grow, to learn, and we should take advantage of that. You know, there's a buzzword now that we all utilize, self-care. And I think self-care is part of that, is a reflective process. It's more than about, you know, going to the ocean or going for a drive, listen to music, although those things can help with self-care. But also self-care involves self-reflection, taking time each day to pause in a quiet place and kind of reflect on who we are professionally, personally, growth areas, as well as celebrate the things that we've done well and how we have walked out this journey called life in a good way. So I think it's good to look both inwardly to reflect and also to say job well done. Because as we've been in a pandemic, we've been in a society which we have vicariously, you know, encountered trauma through some of the mass shootings or tragedies that have occurred in our country. And so as we reflect, we want to show ourselves some grace as well, and not, you know, always be hard on ourselves, but show ourselves some grace as we reflect so that we still can be better servant leaders or healthy servant leaders. I want to shift for a minute. One of your other areas of expertise is co-occurring disorders or substance disorder. I want to talk a little bit about your role in that area of expertise. How did you, get into that area of co-occurring disorders, substance abuse, and how did you kind of grow in that area?
Yeah, it's a very fun story. So when I was getting my master's degree, I told myself there were two populations I never wanted to work with. And please, I'm not trying to be offensive to anyone. I'm just like trying to be transparent. One, I said I never wanted to work with kids. So in regards to my own life, I have 38 nieces and nephews. I love them all very much, but I've just been around kids all my life. So I told myself I never want to work with kids. And I told myself I never wanted to work in substance use. And the way the universe would have it was my first part-time job I got while I was getting my master's degree was doing intensive in-home therapy with kids who have received a diagnosis, so they need more family treatment to help. And then at that time, it was 2006 in New York State, just a few years after they started the license, and nobody knew what the licensed mental health counselor was. So I would apply it at various outpatient mental health clinics as well as inpatient clinics, and nobody would hire me or look at me or even give me an opportunity, but the substance use clinics would. And so I took a job in substance use, and I'm so incredibly thankful I did, because my conceptualization of working with children, as well as conceptualization of working in substance use, was entirely lacking. And also the overlap in substance use and mental health diagnoses is huge. So whether you're working in a strict substance use or mental health clinic, it's very rare you're going to be working with with a client who only has a mental health diagnosis or only a substance use diagnosis. So I've been very passionate about working with co-occurring disorders, because when we conceptualize working even with minority populations, like the LGBT populations, much higher, greater risk for substance use, as well as co-occurring depression and anxiety. So I really was thankful for that opportunity to enhance my skills and also conceptualize how the diagnoses will interact with each other, how the individual, especially if they've endured trauma, it makes sense that they would use substances. And back in the day, we used to treat substance use and mental health separately. So, hey, you've experienced some pretty severe trauma, but you know what? We can't work on that until you stop using substances. And I know substance use is the only thing that makes you feel better, but that means you're just going to have to suffer for about 6 months, and then we'll eventually see it for mental health. And the outcomes were terrible. So luckily now we're seeing changes in integrated treatment where we're helping people focus in on both. And I'm a huge advocate for that, because a lot of times, especially from the mental health perspective and substance use perspective, too many clients slipped through the cracks or didn't receive appropriate care because of the identification as to how these diagnoses interact.
I agree. And you mentioned integrative care. But before I go to there, I want to go to integrative care, you just mentioned it. But thank you for being transparent and sharing your story. I can't help but to go back to something that you said as you started talking. You said 38 nieces and nephews. Did I hear you correctly?
Yeah, my mom had 5 kids. My stepdad had 4. I'm the youngest of 9. So when I say 38 nieces and nephews, it's more like 30, but now my nieces and nephews have kids of their own. So we just include them in. So maybe it's like 28. I don't know, but I know overall the total is about 38.
I only have 3. I have 3 nieces. So I think you've outnumbered me. But it's good to have a large family and have support. You have a larger support system from the family perspective. So I think that is wonderful. But as we talk about integrative care, can you highlight a little bit more the importance of integrative care for our clients and patients that we serve?
Absolutely. Like depending on where you work, you are expected to provide a certain scope of practice services. And most traditional outpatient mental health clinics, if we're working with someone who meets criteria, let's say for cocaine use disorder moderate, they may feel that they don't have the resources available at the mental health clinic, and therefore try to encourage the individual to be linked up with substance use, although they're ambivalent about change. And then also say, listen, we don't know if we can continue to provide you treatment, as well as our psychiatrist providing medications if you're still using these illicit drugs, which then puts the individual in a position where they may just drop out or they may not feel cared for. So within these, like having to, if we can, I respect that there's limitations, like physical limitations to centers. Not every center can actually have both co-occurring treatment at the same place. That makes sense. But if companies can partner with each other and provide opportunities for people to get linked with care, or have discussions using motivational interviewing, or even having representatives from various agencies speak with clients to help build that bridge. I was at a conference in California back in October, and the woman who was the main speaker, she's gone on to do a wonderful, amazing thing. She owns like dozens of businesses. She's spoken for Congress. She's done amazing stuff. And she talked about her own recovery experience, and she had been through several inpatient treatment centers, but it wasn't until she actually went to a treatment center which understood trauma, and someone said, "We're so thankful that you're here." And they said the words of validating, like, you are a person, you are deserving of this opportunity, as opposed to looking at her like someone who was an addict or someone who was a bad person for using. And that aspect changed her life when she had a good treatment program, although it was primary substance use, but had enough integrative mental health and understanding about PTSD and how that then interacts. It was wonderful to hear. So I just think it's sad. I would like to see people have more opportunities to be connected with those services.
I agree with you. I think integrative care is very important as we provide trauma-informed care to our clients and patients, that we understand that from a systems perspective, that is the best perspective if we want to talk about long-term success for our clients and for our patients. So thank you for highlighting that. And when we talk about from a different perspective of integrative care and serving on interdisciplinary teams, the role of the licensed mental health counselor, licensed professional counselor is important. And I think it's evolving that we see more of licensed professional counselors and licensed mental health counselors on those teams, whereas in years in the past, we weren't necessarily present or seated at those particular tables and having those conversations. As we advocate for our profession, as we advocate for licensed mental health counselors, licensed professional counselors, how do we do that? Or what are some of the things we can do to advocate for more increased presence in providing integrative care, being a part of those teams that we have traditionally in years past, maybe we were not a part of? Any thoughts or suggestions on how do we advocate for the profession?
Yeah, and it's absolutely needed, especially as there are various helping professions, and there's not necessarily a history of all the helping professions working together. And I have to highlight the work that you've done to connect with other organizations, connect with other people within the helping professions to look for mutual agreed upon goals. So that is awesome, from the work that you've done with AMHCA and connecting with other organizations. That's awesome. That's on a national level, but even on a micro level, we can still do that. So for my transgender work, I worked outside of New York City, and New York City we would expect it to be welcoming of transgender clients. But despite that, although there were several million people in the state of New York, I was one of only 2 people actually linked with the WPATH standards of care providing treatment. And because of that, there were a lot of people who were providing treatment who may not necessarily have been linked with WPATH. And because of that, I had the National Association of Social Work reach out to me and ask me to provide training and education to various social workers about working with transgender clients. And it was great. So this is this is a couple of years ago, but my brain kept going back to when I was getting my master's degree and how social workers weren't necessarily open to working with counselors. And I remember asking the girl, I really appreciate this opportunity. I appreciate all the work that you've done. And we're like, are you sure you want to work with a counselor on this? And me asking that, they were like, well, why wouldn't we? And I felt great because of that. And then I just think we have so much to share. Our members have so much areas of expertise. We have so much to share with various other helping professions that when people are able to see that we know what we're doing, we provide excellent work, and that we are experts at certain aspects of the field, that opens up the door on the micro level. And I think that makes it easier for things to then move on the macro level. So you've done an excellent job in regards to connecting with the other organizations. I would love to see our members really be supported in their areas of expertise to kind of build those grassroots efforts to connect. And also we're seeing the helping professions continuing to change because we're seeing a lot of peer advocates now.
Yes.
And that's a different type of focus, is a different type of work. So even connecting with peers, connecting with them, and including them at the table. How can we utilize what they specialize in? What would they like to see an area of mental health be focused on? So wanting to include even emerging professions as well.
That is important, to be inclusive of all professionals, because all of us have a niche, all of us have something to contribute to an improved quality of life for individuals to deal with even some public health concerns that our community face. All of us have a role, and clinical mental health counselors, licensed clinical mental health counselors, licensed professional counselors have a role in that just as well as other professionals. So it's good to collaborate, work on a grassroots level, as well as on a national level. As we begin to move towards closing out this broadcast of Prespectives, are there any final closing words you would like to share with our audience in relation to the work that you do, or anything that you think we maybe should focus on globally as a profession? Any closing comments in that area, or in any area you want to share?
Yeah, I appreciate that willingness of like the broad spectrum for me to just kind of get on a soapbox and say what I think is important. There are so many things that we can focus on, and I think that I appreciate, especially with your leadership as well as our current board of directors and all of our wonderful subgroups and subcommittees. I think that we are doing work to identify how we can continue to push the profession in the correct, and not the correct, but a better way, a more with better treatment outcomes. So I think that we're doing that. What I always like to tell people, though, specifically, and hopefully our members, is we're living in unprecedented times. Like, no one could have ever predicted a couple of years ago that we'd be right here, right now. And because of that, we've seen a huge, massive spike in, problems with mental health and substance use. And unfortunately, we're seeing those problems spill out into the culture, into real life. People are being hurt. There's a lot of pain happening right now. I believe that, and this is this is my own belief system. I'm not trying to push this on anyone, but I believe that we're here for such a time as this. Every single one of our members, whether they're a member or not, or anyone within the helping professions, your work is so valuable, especially now. You are needed so much now. So therefore, please take care of yourself. But please, to every one of our members, even for people who aren't members, please do not minimize the work that we do. We are not just doing something. We are hopefully helping people heal. We are hopefully helping the nation heal. Hopefully our conceptualization will help broader interactions with various cultures and various people across the world. The work that we do is important. It does matter. It's never just a job. And if we can just maintain that commitment to helping people, especially in difficult times where even we may be worn out, I think that we're going to eventually be in a better position.
Thank you. Thank you. We are healers. We heal in a different way than other professionals, but we are a part of the healers, and we're part of the frontliners. So thank you for joining us today on Perspective. Thank you for the work that you have done in the counseling field. Thank you for accepting the torch as I pass it on to you as we go into 2022, 2023, as the president, national president of the American Mental Health Counseling Association. I am sure and confident that the organization will be in good hands with you at the helm. So again, thank you for your leadership. Thank you for what you bring to the table and the service you have already provided, and that the good work you will do in the future for the organization. So thank you, Dr. Fred, and we look forward to an awesome year and working with you as a president of the American Mental Health Counselor Association moving forward. Thank you for being a guest on Prespectives.
Thank you. Have a great day.
Thank you for joining the American Mental Health Counselors Association podcast with President and Interim CEO/ED, Dr. Beverly Smith. We hope you will join us for the next episode to connect and hear the perspectives from experts and the organization that exclusively represent clinical mental health counselors. Be well.